Good afternoon, everyone. Today we are going to discuss about emergency contraception in OG subjects. In this emergency contraception, what are the things we have to discuss? First, introduction, history and indication, advantage and methods of emergency contraception. Emergency contraception is a method of contraception we can use in an emergency procedure before menstruation is missed or to prevent the pregnancy following unprotected intercourse or accepted failure of the any contraceptions. So this is emergency contraception. So emergency contraception is nothing but it is one of the birth control method. It prevents the pregnancy after unprotected sex. So this is the definition of emergency contraception. So history. In 1967, the first widely used methods were 5-day treatments with high dose estrogens using ethyl in the USA and ethyl estradiol in the Netherlands. In early 1970s, the UPS regimen was developed is combined with preparation of containing both ethyl estradiol and levonorgestrel. So in 1974. 1975, the progesterone only postcoital pills was investigated. And 1975, the copper IUD was first studied for use as emergency contraception. And 1980, danazol was tested but was found to be ineffective. And 1980, USP regimen became the standard treatment for emergency contraception in many countries. And 1998, after a large World Health Organization trial, use regimen was gradually withdrawn and levonorgestrel widely used. So 2002, China was the first country where mifepristone was registered for use as an emergency contraception. So indication. For aged couple, those who are infrequently they are doing a intercourse, so that person may have to take a emergency contraception pills, and following a single act of sexual exposure in young girls. Sometimes because of the rapism, the young girls or adolescent girls accidentally they can get a sex. So if we are to prevent that, we can take this emergency contraception with the help of doctor prescription. Next it is when pregnancy is apprehended owing to rupture of the condom or premature ejaculation in the couple practicing the coitus interruptus. So these are the reason we can use this emergency contraception after intercourse. Next advantage. So in this advantage, we have to save the couple from unwanted pregnancy, from unnecessary operative interference for fear of pregnancies, prevent adolescent pregnancies and help to reduce the unsafe abortion. And before the method, two types it is there. One type it is emergency contraception pills, another one it is copper IUD. So this emergency contraception pills, how it will be work means it making to delaying the ovulation, that is the delaying of the egg to release. So if it is there, so the person doesn't get a fertilization. So when we have to do this within the up to 72 hours after intercourse. So this is emergency contraception pills. Another one it is copper IUD. This is also very more effective. So this how when we have to put this copper T mainly within 5 days after intercourse. So this function it is prevent the fertilization. So egg and sperm will not be come each other. Next it is method. The two methods of EC are available. One it is a hormonal method and one is mechanical method. Hormonal method is combined estrogen and progesterone pills and progesterone only pills. It will be there so that we can use to reduce the contraception. Next this is the hormonal method, combined ethyl estradiol, and next it is progesterone only pills. Then how effectiveness it is there? So 100 percentage no emergency contraception pills, 8 pregnancy may chance to get for 100 out of 100. Progesterone only pills, if you are using, out of 100 only one mother get pregnant, and combined estrogen progesterone pills, and out of 100 only 2 mother may get a pregnancy. Next it is mechanical method. Mechanical method, we can use the copper T, and initially we can use copper 7 and copper T 200 were used, and later multi-load copper 250 and laterally copper 375 and copper 380A without single failure rates. These are the copper T different types that we can use to reduce the fertilization. So nowadays most commonly used copper 380A. So this is the effectiveness. If you're using IUD, it is a 99%. Only emergency contraception pills 64% or 84% are effective, and the 63% if it is using emergency, that is estrogen and progesterone pills. Side effects: 50% of the mother have a nausea, and 20% it is vomiting, bleeding and pain and expulsion and pelvic infection it will be present. So when come to conclusion, the benefits and pitfalls on emergency contraception are outlined and will need to be considered by every female patient that wishes to prevent an unintended pregnancy. So I hope everyone understand about emergency contraception. So emergency contraception, if it is defined, means it is a birth control method, is prevent the pregnancy after unprotected sex. Within 72 hours we have to take the pill. So types used in mechanical method, only we are using a copper T, copper IUD intrauterine devices. In that we can use 200 and 380A we are using nowadays. Thank you.